Artificial Intelligence Doctor www.abcpharma.net/English. User question. Can you give me 10 questions related to no atrial pacing after Aveir VR leadless pacemaker implantation? Cohere AI. Sure. Here are 10 questions related to the absence of atrial pacing after Aveir VR leadless pacemaker implantation. 1. What is the primary purpose of atrial pacing in a leadless pacemaker such as Aveir VR? 2. Under normal circumstances, how does atrial pacing support cardiac function? And in which medical conditions is it particularly beneficial? 3. Are there specific indications for atrial pacing that are unique to the Aveir VR leadless pacemaker? 4. In the absence of atrial pacing after Aveir VR implantation, how is atrioventricular synchrony maintained? 5. Could you explain the potential advantages of not having atrial pacing capability in this type of leadless pacemaker design? 6. Are there specific patient populations or cardiac conditions where the lack of atrial pacing functionality might be a contraindication for the Aveir VR device? 7. How does the rate response feature of the Aveir VR pacemaker adapt to a patient's physiological needs without atrial pacing information? 8. In what scenarios might a patient with an Aveir VR pacemaker experience symptoms or complications due to the absence of atrial pacing capability? 9. Are there programming or algorithmic strategies used in the Aveir VR pacemaker to mitigate the potential drawbacks of not having atrial pacing functionality? 10. For patients who may benefit from atrial pacing in the future but currently have an Aveir VR leadless pacemaker, what are their options for upgrading the device or receiving additional therapies? These questions delve into the implications and considerations surrounding the absence of atrial pacing in the Aveir VR leadless pacemaker. They explore the device's design, functionality, and suitability for different patient populations, as well as potential limitations and future options for patients. Claude AI. Certainly. Here are 10 questions related to the absence of atrial pacing after the implantation of an Aveir VR leadless pacemaker. 1. What are the potential consequences of not having atrial pacing in a patient with an Aveir VR leadless pacemaker? 2. How does the lack of atrial synchrony in single-chamber ventricular pacing affect cardiac function and hemodynamics? 3. What is the risk of developing pacemaker syndrome in patients with an Aveir VR leadless pacemaker and no atrial pacing? 4. How does the absence of atrial pacing influence the incidence of atrial fibrillation in patients with an Aveir VR leadless pacemaker? 5. What are the indications for considering an upgrade to a dual-chamber pacing system in patients with an Aveir VR leadless pacemaker? 6. How does the lack of atrial pacing affect the interpretation of pacemaker ECGs and the assessment of pacemaker function? 7. What is the impact of long-term single-chamber ventricular pacing without atrial synchrony on the development of pacing-induced cardiomyopathy? 8. How does the absence of atrial pacing influence the programming and optimization of AV delay in patients with an Aveir VR leadless pacemaker? 9. What are the potential benefits and limitations of atrial sensing algorithms in leadless pacemakers like the Aveir VR in the absence of atrial pacing? 10. How does the lack of atrial pacing affect the long-term clinical outcomes and quality of life in patients with an Aveir VR leadless pacemaker compared to those with dual-chamber pacing systems?